Okay, welcome y'all. So we're ready to take a look at our fetal pig. You can see him or possibly her over here in our dissection space. Pull them out. If we were doing this in class over a week or so, I would have you save this bag to repackage him for later. But since we are just doing this in one long marathon and you're going to watch it on YouTube, I'm going to just go ahead and throw that out. Okay, so first of all, the first thing it asks you for, let's get oriented. You remember that on a human, anterior is towards the front, posterior is towards the back, and that's true of our friend the pig here too. But what you've got to remember is that if this little guy was walking around, he would be on all fours like this, not head up like you and I are. So the head is going to be anterior, and the rear end is going to be posterior. Whereas on you, the crown of your head is actually superior. So anterior towards the head, posterior towards the tail, and then this is where we get to, well, before I get there. Medial and lateral work exactly the same way they do on a human. Medial is going to be closer to this midline in between the nipples. Lateral will be towards the sides of our pig, so out here. When we get to superior inferior is where this gets weird, because on you and I, we think of anatomical position. If I am standing upright, superior is towards the crown of my head. But like we just said, piggy friend here, the front is actually where the head is. So for them, superior is towards the spine and inferior is towards the belly, which is confusing, which is why we don't really use those terms about animals. Instead, the terms you're going to hear are dorsal, meaning towards the spine, and ventral, meaning towards the belly. So dorsal, ventral side of the pig. What else do we need to note? How is our, okay, our camera works not bad. Let's look for some of these structures where it says external anatomy of the fetal pig. First thing it asks us to do is detect the sex of the pig. So what do we got here? Okay, so this is back here under the tail. You're going to see a little bump. It's called the urogenital papilla. See that little kind of flap on top of my thumb? That's the opening of the vulva. She, unlike human females, would have her urethra inside of that opening as well. So pigs actually do pee out of their vaginal opening, unlike human females. If she were a male, then instead of that little papilla here, we would see a couple of little bulges between the back legs where I'm pointing, and you would see a little hole right behind the umbilical cord. This is the umbilical cord where her belly button would have been if she'd lived to be born. There would be a little urogenital opening right here that would be basically the opening of the penis. So yeah, umbilical cord, like it describes on your paper, is right here. And both males and females are going to have nipples, just like if you think of humans, both males and females have nipples. So here, I don't know if you can see. Can we get a little closer? You can kind of see them. These little white dots here would be nipples. Notice that they have like 6 or 7 sets. That's because pigs sometimes do have 10 or 12 piglets at a time. So they need to be able to do that. Need to be able to nourish that many young at the same time. Okay, our fetal pig is, I'm gonna say probably 15-ish centimeters. So based on our chart, you can kind of estimate where they're gonna be in between in terms of gestation. Don't have a ruler handy for you to measure that, but make your best guess for answering the questions based on piggy is about 15 centimeters long. Observe the toes of the pig. We'll let you get a good look here. You can see there's the divide. We've got a toe on either side. These guys are what's called cloven hoofed. It's the old-fashioned term for that. So based on that, you can figure out how many toes they have. They also have the same in the back. So 2 in front, 2 in back. It also asks you to observe the eyeball, which always is a little messy and kind of gross. So we got, yeah, sorry if this is squicky for some of you. You can see there's a little bit of an eyelash there. And you can kind of peel the eyelids back. I'm trying not to have to cut. We'll see. Not gonna work. We're gonna have to cut the eyelid. I hate this part. So you're able to see this is a fairly well-developed fetal piglet, fairly late in gestation, getting close to the point in the pregnancy where they would actually be born. But that is not a fully developed eye yet, getting close. You can also, if I peel back that little bit of eyelid there, you can see this little whitish membrane inside, right? What's that? Oh, no, that's part of the sclera. Never mind. I don't think she actually has a nictitating membrane. Cool. So eyelid, you can see the eye. I would say it's getting close to the point where the piglet could have been born. Up to you to speculate on the eyes open or eyes shut, or to go look it up. If we were to open the mouth, like it asks in question 6, this is the hard part. I hate this because it's going to go crunch. Oh, I hate it. Okay. A little bit of ripping and tearing is kind of normal there. Got some junk that was inside the mouth and nose. All right. We are looking for the hard and soft palate. Okay. So if you peel the mouth open, this is a little tricky. You're going to be able, can we maybe tilt? Well, we'll do our best. I may have to get it closer in a second. There's a ridged part in the front that is called the hard palate. If you press on it, you can feel, or you would be able to feel that it's hard. It's full of lots of little bumpy ridges. And then in the back is the soft palate. You can feel this in your own mouth. If you poke with your tongue, you have a hard palate and a soft palate as well. Let's see if we can get close enough. You can at least see, kinda. There are the ridges of the hard palate. The soft palate is further back where it's kind of difficult to see. They also have these little sensory papillae along the edges of the tongue. And if I were able and strong enough to prise this more open, you'd be able to see the opening of the esophagus in the back. It's not going to be a prosperous attempt if I try to peel it open more. You can also feel along the edge here for whether our little one here has teeth. Yes, she very much does. They're actually quite sharp. I had to be careful getting the mouth open. She has 2 on the bottom, 2 on that side, 1 on the top on each side. So at the moment, she's got 6 total, 4 on the bottom, 2 on the top. Let's see, what else do we need to know? Are humans born with teeth? If you don't know the answer to that one, go look it up. Some of you who have baby siblings may know from experience. Okay. The fun part. Actually, here, I'm going to pause here and we will break this up into more manageable chunks.